you to tonight's event. I'd also like to thank Aaron Fox and our KSB Community Wellness for sponsoring this presentation tonight. I also have a special guest, Dr. Chris Singh, with me as well.
Good evening, everyone.
So tonight, what we'd like to do is we're going to cover winter foot and ankle injuries. We feel this is a pertinent topic for what we're experiencing right now, especially with these really cold temps as well. So without further ado, we'll get started. So some of the topics we're going to cover include trauma with foot and ankle injuries, and then also cold injuries, frost nip and frostbite. What are some of the exam findings that we'll see with these conditions? And then various treatment options, conservative treatments, surgical treatments when appropriate, when to seek emergency treatment when necessary as well. And then we will cover preventative measures. So regarding foot, ankle sprains and fractures or breaks, a lot of these injuries we see occur from falls, and that makes a lot of sense, especially with the ice that we have under the snow. These fractures can be very subtle, or they can be really traumatic and pretty extreme as well. A lot of times we see these injuries from twisting. You can have injuries just in the foot, just in the ankle. You can have both, and you can even have injuries higher up, including the knee. So we really have to do a thorough exam, make sure we're identifying everything that's happening. In regards to cold injuries, there's two types, frost nip and frostbite. And the difference between these two is frost nip is less severe, and the cold does not penetrate as far down into the skin and deeper tissues than frostbite does. Frost nip is easier to recover from. Frostbite can become complicated and can result in further treatments such as amputation, which we try to avoid at all costs. Some of the exam findings that we are looking for regarding foot, ankle sprains, and fractures include pain where patients are painful at, bruising and swelling. We typically see a lot more bruising and swelling when there are breaks, and then possible deformities, which will be an indicator of a more severe injury. Is the patient able to bear weight? This can be very helpful in distinguishing between sprains, severe sprains, and broken bones as well. And then also open wounds. Unfortunately, we do see some injuries that create open wounds, and these do become surgical emergencies at this time. The instability that I have listed here as well comes from chronic ankle sprains, and ankle instability can be very tricky to treat, and it's something that we do not want to take lightly. When there is ankle instability, this increases your risk of future injury, which can result in another sprain, a more severe sprain, or a break. A lot of times when we are able to diagnose this chronic ankle instability, we collaborate with our physical therapy department, which does a fantastic job to help strengthen the ligaments and all surrounding tissues in our foot and ankle to help prevent these further injuries. Some exam findings regarding cold injuries. We may be out in the cold for a little too long and you feel a little tingling, some numbness in your tips of your toes and your fingers. This can be reversible once you go inside and are in a warmer temperatured environment. There also are other skin changes as well. Sometimes we develop swollen or red bumps, even blisters or wounds, depending how deep this frostbite injury is penetrated into our skin. Itchiness and then discoloration of the skin. We see discoloration more common with frostbite, which can be an indicator that there is necrosis of the skin or dying of the skin, unfortunately. And it doesn't take long for us to develop these symptoms. When temperatures are around 0, it only takes 30 minutes of exposure to develop some of these conditions. For example, when the temperature is lower than that, -15, it only takes 15 minutes. And so as the temperature decreases from there, that time frame even shortens even more. So now I'd like to turn it over to Dr. Chris Singh for the next section of our presentation.
Okay, so some of the questions that we receive on a daily basis is, when should someone report to the emergency room if facing an injury? Like discussed earlier, we can see possible foot and ankle deformities with different falls or ankle rotational injuries. Sorry for the graphic image, but if you look to the right, if you see an ankle deformity like that, we would suggest absolutely going to the emergency room. As well as the open wounds. When we have these ankle fractures that do occur, there's that slight case or slight possibility of having an open fraction, which is a medical emergency. So that is definitely one other reason why to go to the emergency room. If you are having severe pain out of proportion after having an injury, we would absolutely recommend getting that evaluated, being able to get x-rays to just confirm that there's no further injury going on. And then, like Dr. Swanson has talked about earlier, is the patient able to bear weight? If the patient is unable after this injury to put any weight on their extremity, there's a high likelihood of a pretty severe injury, and that would need to be evaluated as well. And then, of course, with any fall, we always want to make sure there's no other further injuries, more proximal or more farther north of the foot or an ankle, including head trauma, to be evaluated for as well. And of course, we always just say, if you're ever second guessing if you should go to the emergency room or not, we would recommend to get evaluated, because it's always safer to be it's better to be safe than sorry. And then so when it comes to these different injuries, we do both conservative and surgical treatments with these. First, we initially would like to protect these people in either cam boot, short leg cast, or posterior splints. The posterior splint is similar to a cast in that it is fiberglass. It just goes from the bottom of your foot and wraps around the back of that ankle and up your leg. And we use all these different modalities in order to help offload or completely non-weight bear certain patients based on what we do find clinically and on imaging. We always say RICE when having an injury. That stands for resting, icing, compressing to help with swelling, and then elevating as well to help with the swelling. And then obviously, if we're in excruciating pain, we would recommend minimizing that activity just to allow all the inflammation to calm down. And then long term, bracing isn't always good for long term because we say it can weaken the ankles. But for short term, if we do have an ankle injury that needs support, we recommend ankle braces, which we work closely with our physical therapy department to help with those things. And then obviously we always, especially in the winter, recommend supportive shoes and boots to help with the traction outside in the snow. And then, unfortunately, we do face some medical emergencies, like I had talked about earlier, and that would require surgical treatment. We have, unfortunately, we face open fractures, which would cause us to go straight to the OR to debride, and then we use what's called external fixation for some of these cases to help stabilize the injury. And then we perform ORIFs, which stands for open reduction internal fixation. And in order to do that, what we do is we place the fractured ankle back into its anatomical place, and then we fixate that in proper alignment utilizing plates and screws and K-wires, which is just a thinner wire. And then when it comes to just winter and preventative measures, we always recommend wearing supportive shoe gear, like I said earlier, with boots with good tread and slip resistance. We also want to avoid any water to get into the shoe gear, because we do not want to face the different injuries, the cold injuries that Dr. Swanson has talked about. And then you want to make sure you have the proper socks, and you want to keep those feet dry and warm. And with what I would recommend, if you are in the snow and you're walking in the snow, I would check your shoes and socks once you're inside to make sure that they aren't wet and damp. And then you always want to make sure your sidewalks are clear when you can help that. to avoid any slipping on ice. And then, of course, want to be cautious with black ice. And then from a podiatry standpoint, we do see a lot of patients with peripheral neuropathy, which we have had a topic on in the past. And basically, it's nerve damage in the feet. There are multiple causes to this. We just want to make sure that because these people do lack feeling in the lower extremities, that they are checking their feet and making sure that they are not wet and damp and cold, just to avoid having those cold injuries.
All right, well, great. Thanks, Dr. Singh. Thank you, everybody. I appreciate you joining tonight again. If you get a chance to, we'd appreciate if you'd fill out the evaluation in the comment section. If you have any questions, feel free to leave those as well, and we'll get back to you. Hope this was helpful, and I want everybody to stay safe and warm out there. Thank you very much. Have a good night.